Okay, good afternoon. Welcome to our presentation on solutions for diabetes in Caswell County. We're very glad that you all could join us today and learn more. So we do have an exciting lineup of presenters today. We have 3 different presenters, including myself. First one is Kaitlin Rose from the Caswell County Health Department, and she's going to talk to you a little bit more first about her program and what they do at the health department. Then my name is Laura Plunkett, and I'm from the Piedmont Triad Regional Council, the Area Agency on Aging. And then I'm going to share a little bit more about some diabetes work that we do in the county. And then last but not least, we have Kaitlin Fall, who's from Piedmont Health Services, and she's going to share as well. So you get to see a full rounded experience of all the different services and solutions that we can work together towards for diabetes in the county. I'm going to go ahead and switch the presenter now to Kaitlin Rose, and she's going to share with you all about her program.
Hi, everybody. So I do diabetes prevention program, which is targeted to our pre-diabetic patients here in the county. Just trying to do like lifestyle changes with them to get them to get their A1C lower. That way we can help prevent them from ever getting type 2 diabetes. And if the goals are to like losing weight through healthy eating, being more physically active, and learning to overcome barriers to healthy eating and physical activity. Just like things that they might not be aware that they're doing in their daily life that could hinder them from meeting those goals. We do encourage all the participants to lose a goal of 5 to 7% of their starting body weight and doing 150 minutes a week of moderate physical activity. With this, like say they're like around 200 pounds, they can lose up to 7% starting, which would be about 20 pounds of their of their body weight to start getting their healthy weight. And it's recognized by the CDC as a lifestyle change program. And it's evidence-based program with which we have had participants show success in this program to make these changes and not be at risk for type 2 diabetes. And that's by 58%. And like I said, for a person who weighs 200 pounds, losing that 5 to 7% of their body weight is just 10 to 14 pounds over starting over like a 16-week period, which is not a drastic weight loss, but it does make that lasting impact to continue. Our eligibility requirement is you have to be 18 years or older and to have a BMI of 25 or greater. If we have female patients that are of the childbearing age that have gestational diabetes or currently have prediabetes, or anybody that's currently got prediabetes, as determined by either a risk test or a blood test within the past 12 months from their provider's office. Now, if you have type 1 or type 2 diabetes, you're not eligible for the DPP program, as we're trying, like I said, targeting those pre-diabetics. This is just like a little guide of the ranges for pre-diabetes, our normal glucoses, and our diabetic glucoses and A1C levels. And then we do meet for 24 to 27 weeks. The first 16 is weekly, and it's usually for an hour, and the first 16 weeks are core sessions. And if participants do miss for any reason, they are required to make up the first 16 weeks worth of sessions. And after the core sessions, we go to post-core sessions, which meet twice a month, and then we go to monthly. And these gives additional support and learning opportunities to our participants and help them maintain those lifestyle changes, and help encourage them to continue to lose more than their 5 to 7% weight loss. And these are some of the things that we do cover in DTP, like being active, tracking your physical activity, eating well, and tracking what you eat. With that, we encourage them to log what time they eat their food and beverages, and then their fat grams and calories, so they're aware of how many calories they are consuming throughout the day. And that way they can kind of see how many they need to burn to lose their goal weight. And then we teach them how to shop and cook healthy foods. And then we manage stress. I think everybody probably will need this lesson of managing stress and coping with those stressful triggers. And then eating well away from home, we teach how to look at your menus at whatever restaurants you're eating at, and just knowing those healthy alternatives at restaurants. And then keeping your heart healthy is also one of our topics, which coincides with being a diabetic. It's been linked to diabetes and heart disease have kind of coincided there for a while. And then we expect the participants to make a commitment to attend the sessions, post and core sessions, and to make up any of those sessions missed, because it's very crucial. If you miss one, then you miss out on different things that you might need to learn or want to learn. And then we do expect that they will lose the 5 to 7% of the body weight, if not by the goal set, but at least by the end of the 27th week. And then making sure we get to that 150 minutes worth of exercise per week, and then tracking what we eat and any other activities we might do. And there is a cost to do the program, which I have found success with this. I found that if somebody does pay the $25 for the program, they're more apt to stay with it versus somebody that doesn't pay for it or gets the scholarship for it. And we do get incentives throughout the program. I think we get up to 10 to 15 incentives throughout the whole program. And I emphasize with our participants that this is not a diet or exercise program, it's a lifestyle change. And it is limited to 12 participants per class, but I usually do 2 classes per year. So that's where I stand on that. That's the end of my PowerPoint. And I was going to show the flyer. Hold on, wrong flyer. This is our flyer for the class. Like I said, I'm starting up a new class in March, and it's going to be on March the 16th at 2:30 to 3:30. And it's going to be at the Senior Center here in Caswell. And if you do want more information, y'all can contact me here at the health department via email or phone number. And that's all I have on the MDPP.
Great, thank you so much, Kaitlin. Does anyone have any questions? So Kaitlin, I have one question. So does there need to be a doctor referral for the person to participate in the class, or just if they've been, or do they just take an assessment and that's how they qualify?
If they have been told by a provider that they have pre-diabetes, which that range is 5.4 to 6.5, and they know what that number is, then they'll report that to me, and then they can do the program. But if they want that doctor referral, I'm working with Caswell Family Medical Center, and I do have a referral form that if they want the provider to fill out, then they can. I can just send that to any of the providers that are interested.
Okay, perfect. I was just curious, you know, what the relationship with that is, but great, thank you. Any other questions? So just one more question, Kaitlin. So if people wanted to register for your upcoming class, should they just give you a call, or do they call the senior center? Okay.
They would call me directly here at the health department, and my number here is 694-4129 extension 8133, and they would ask to speak to me if I'm not at my desk, and I can go over with all the paperwork and everything with them.
Okay, great, wonderful. Well, thank you for sharing, and if anyone does have any questions, feel free to contact Kaitlin, and I'm sure she'd be happy to answer those. So I'm going to go ahead now and move on to the next section of the presentation, which is talking about Diabetes Age Well Services, which is provided through the Piedmont Triad Regional Council, which is my organization. And so here with me today, I also do have Adrienne Calhoun, who's the Assistant Director of the Area Agency on Aging, and my name is Laura Plunkett, and I am the Health Promotion Coordinator. And just a little bit about our agency, we do serve 12 counties, including Caswell County. And so Caswell County is actually the first county that we're rolling out this initiative that I'll be talking to you all about today. So one of the reasons that we chose Caswell County to start with was looking at the information in the percentages from, I believe it was the Caswell County Health Department collection of data. And so we know that by 2030, which is getting closer and closer every day, 1 in 5 North Carolinians will be 65 or older. So we know that the number of older adults is growing every day, and that among those people, 92% of people over the age of 65, they have at least one chronic condition. And so it might be diabetes, it might be heart disease, arthritis, or cancer, and that 77% live with 2 or more chronic conditions. And we know how difficult it is to be able to manage these conditions, and so that's why we have these programs that I'm going to be sharing with you today. And just looking at the percentage of the total population in Caswell County that has diabetes, we see that 18.5% of the population has diabetes, and when we're looking at the North Carolina average and the U.S. average, both of those are lower. And same with the percentage of Medicare recipients in Caswell County with diabetes. We see that that number grows even more. So 31.5% have a diabetes diagnosis, and both of those are higher than the North Carolina and the U.S. averages. And so what are the services that we offer? Well, we offer 2 programs. One is diabetes self-management training, also known as DSMT. And so what this is, it's a mix. It's actually 1 hour of individualized education and then 9 hours of group education. And so the curriculum that we use, I'm going to talk to you guys about in just a second, but it's an evidence-based group curriculum. For us, we have 6 sessions in total, and we do recommend that the participants attend all of the sessions, as the sessions do build upon one another. and they include a variety of different topics. There's actually a toolbox that's part of the program that include topics such as healthy eating. We talk a lot about that, physical activity, blood sugar monitoring, making sure people are adherent and understand why they're taking different medications, talk about foot care, and then also how can they best communicate with their healthcare provider is another big piece about what we talk about in the class. And so our diabetes self-management education and support services were accredited by the American Association for Diabetes Educators, and we've been accredited since 2017. So we've paired that with medical nutrition therapy and one-on-one meetings with a registered dietitian. So our registered dietitian for this program is Penny Crumpton, and so she's really been instrumental in adding value to these group education classes that we had been providing previously. Because instead of just saying, oh, you should talk to a registered dietitian, we have one that they're already meeting with. And also the registered dietitian helps create an individualized assessment, so to see where they are before the class, and co-creates an education plan with the participant, so to make sure that they're getting the most out of the class and meeting those education points that they would like to meet. So our curriculum is Living Healthy with Diabetes. This was actually developed by Stanford University. And the Living Healthy with Diabetes curriculum is something that we have been doing for many years. And so this program, it meets once a week for 2.5 hours for 6 weeks. And it is a very highly interactive program where there's a lot of group sharing and support as well. And so in this class, a big thing that we do is not only share knowledge, but also build self-management skills, which is really important because they're learning how to do things like set goals and achieve those goals. If they come across a problem, they have problem-solving skills. If they have a new difficult decision that they need to make, they have decision-making skills. So that beyond just the knowledge that they're gaining, they're having lifelong skills that can help in managing their diabetes and also in their life in general. And so these programs, they are taught either by professionals or by volunteers. And so for our class, how it's structured right now, Adrienne Calhoun is one of the instructors, and then Mary Lou White is the other instructor, and she has diabetes herself, so she can really relate to the individuals in the class, and they can see her being successful and follow along in the same way. And so we hold these classes in a variety of locations, and primarily in Caswell County. We partner with the Caswell County Senior Center to be able to offer this program. So really quickly, I'm just going to do a brief activity from the class so that you guys can see about some of the topics that we share in the class. And one of the biggest topics that we share is how your mind can have effect on your body. And I'm sure everyone has heard, the phrase mind over matter. And so one of the things that we talk about in the class is how there's certain tools that you have and that you'll develop as part of the class, and how that can help you overcome pain or fatigue or difficult emotions that you're having. So I'm going to go ahead and share the activity now. So I can't see you, so I can't tell if you're doing it or not, but I'll just trust that you are. But if you could go ahead and get comfortable in your chair and close your eyes. So we're going to do the lemon activity. So imagine you're holding a big, bright yellow lemon. Picture it in your mind. You can feel the texture of the lemon rind in your hand. Now lift the lemon to your nose. You could smell its strong citrus aroma. Now bring the lemon to your mouth and take a big bite out of the lemon. It's juicy. The juice squirts all through your mouth. Okay, you can go ahead and open your eyes. And I can't see your reactions, but a lot of people, especially when we do this activity, might feel some salivating. They might have felt like something tasted sour. You might have had some puckering. And so that's really just showing you that you might have felt physical symptoms when really it was just the words, right? And so those physical symptoms were felt even though there was no lemon actually present. And that's just an example of how the mind can affect the body with very little effort. And so that's an example of an activity that we do in the class. And each class has a range from 6 to 8 different activities that we talk about and we cover. So it's fun, it's interactive, and it's really a chance for people to share and realize that they're not alone, that there's other people that are going through this, and everyone has different challenges and successes, and we can work together to all have a better outcome. So when we're looking at specifically our past successes with this program, where we're adding the registered dietitian and some additional components to that curriculum, Living Healthy with Diabetes, we did hold a pilot project with Caswell Family Medical Center to test the referrals process, because these are 2 Medicare benefits. So you do have to have a diabetes diagnosis to be eligible for the program, and you also do have to have a doctor's referral. And so we were able to do a small pilot where patients did see a drop in A1C. And then in April and May of last year, we held our first full community program, and this was in partnership with the Senior Center. And we had 16 participants, and we heard some wonderful outcomes from that program, and including that we saw that people had an increase in healthy coping methods. So, they might not have known how to handle their diabetes as well before the class, but after the class, they felt confident that they could do that. Also, an increase in self-efficacy and medication adherence as well. So that was a combination of those knowledge aspects as well as some of that self-management skill building that we do in the class. As well, with that first community class that we held, we saw on average a 6-pound weight loss among participants during the course of the program. I have this one testimonial here, which is from an individual that took the class and shared how much they enjoyed everything that they learned in the class. And they shared a little bit about how they started out at one weight and one A1C, and they saw a drop in both. And so this participant said, "I truly believe this class has helped me to reach this. I plan to keep my food intake in small portions and keep at checking my carb and blood sugars." So just one example of some of the positive feedback that we've heard from this class. Now, especially, we've been doing the program, the Living Healthy with Diabetes program, but now we have the additional component of the registered dietitian, and we've really seen some positive outcomes. So we do have an upcoming offering. It's also at the Senior Center. And so our offering starts on March 6th. And again, this is for someone that has type 2 diabetes and they do have Medicare. And so if you know anyone that is interested, we are still taking individuals in the class. And the class is from 8:30 to 11 at the Caswell County Senior Center. I would need their doctor's referral. So if they are interested in taking the class, they would just need to contact me beforehand so I could work to get that referral process in place. So we could go ahead and get moving, and then they would be able to go ahead and start meeting with the registered dietitian to set up some of that more individualized education. And so here's my contact information. It's up in the upper left-hand corner, as well as Mary Lou White and Adrian Calhoun, who are both instructors for the program, if you were interested in contacting them and finding out more information. And that's, in a nutshell, what I would like to share about our diabetes solution in Caswell County. Does anyone have any questions? Okay, well, thank you guys for listening. And just one other thing, caregivers, families, and friends, they're welcome to come and learn as well. They may not be able to meet with the registered dietitian individually, but they're welcome to attend the group education. And we've found that that's been really helpful, especially if it's, a husband-wife team or mother-daughter team. Them learning about it may be very influential on the health outcomes of the participant in the class as well. Okay, well, with that, I'm going to go ahead and switch it over to the other Kaitlin, Kaitlin Fall from Piedmont Health. I'm going to go ahead, Kaitlin, if you're ready, I'm going to switch the screen to you.
I am ready.
perfect.
Perfect. Thank you, Laura.
Yes, of course.
All right, so as she said, my name is also Kaitlin. I'm going to be talking today a little bit about the medical nutrition therapy services we offer through Piedmont Health Services. So Laura kind of touched briefly a little bit on what exactly M&T is and everything else. Oops, sorry. And so I'll just be building on that a little bit more. So first and foremost, I just wanted to introduce myself. So my name is Kaitlin Fall. I am a registered dietitian licensed here in North Carolina. I completed my dietetic internship through the University of Kentucky before moving here. I am bilingual, so we offer the services both in English and Spanish. And I'm also working towards becoming a certified diabetes educator just to further support, the diabetes component for MNT. And so I've been here with Piedmont Health Services since September of 2017. We started the MNT services in August of last year, so we're still kind of learning. It's something a little bit new still, but we have been offering it at some of our other PHS sites for longer, just not sites that are in Caswell County. So let's see, I'm going to get this out of the way for us here real quick. There we go. So a little bit about Piedmont Health Services first and foremost. Our mission is to improve the health and well-being of the community by providing high-quality, affordable, and comprehensive primary health care. So PHS runs 10 community health centers, primarily in Amant, Chatham, and Orange County, but we do have one that kind of sneaks across the border into Caswell County here, and that's Prospect Hill Community Health Center. So since I'm still learning North Carolina geography, I put on this map here, so you can kind of see the little red dot right here down Prospect Hill, and that's where the Prospect Hill Community Health Center is located. And so it's not just the M&T services for diabetes. We also just have general medical services if someone's in need of a primary care provider. We have a dental clinic, a pharmacy that's on site. We also have a WIC office and offer behavioral health support. So we're a very comprehensive kind of health center trying to pinpoint any need that a patient might have. And so more specifically about the medical nutrition therapy services that I provide. Let's see. My computer's thinking. Oh, there we go. So I do meet with patients for M&T for a variety of needs, but kind of specific to diabetes, it is shown to be a pretty key part of that diabetes care and maintaining control. Laura kind of already touched on this a little bit, but one study did show that about half of patients feel like there's a need for more discussion and education on what exactly is their A1C, what does it mean, and how can they kind of work on glucose control and really reaching their goals. So through the M&T, I can provide kind of motivational interviewing, help individuals understand, the need to change, find some goals that are very individualized for them and that will work for their lifestyle. So we typically meet about every 4 to 6 weeks. So really kind of working on those self-management skills so that time in between they can feel like they have the tools needed. And then certainly that nutrition education piece with diabetes, kind of recommendations for eating and everything else. And in one study in particular, it showed that there was about a 1% decrease in A1C with allied healthcare providers following like a specific protocol or treatment algorithm. So I can also help patients with titrating insulin, which can certainly be something a little bit confusing on their own. And they may not be able to follow up with their primary care provider often enough to really kind of do that process. So I can meet with them, kind of explain it a little bit more. And usually that does help to lower A1C. Now, primarily, I've been meeting with patients who are patients here at PHS. They have their PCP here, and so the PCP actually drops in on the visit, but anyone is welcome. So if they have a provider elsewhere and are wanting to meet with a dietitian, we can work with them. We would just need a referral from the provider. And I meet with patients every Monday and Thursday, and then there are some late night appointments available between 5 and 8 p.m. for people that need a little bit more flexible option. Typically, we meet about 45 minutes or so, but that definitely depends on the patient specifically and kind of their motivation level, what questions they're coming into the visit with, and everything else. With that, I usually follow up every 4 to 6 weeks, like I mentioned, so very much trying to help them figure out how they can manage this on their own for that time in between. Sometimes a closer follow-up is certainly necessary, but I very much leave that up to the patient and kind of what's going to work for them. So thinking about kind of all of these services that we offer, if you all know of anybody who could certainly benefit from this, like I said, as far as Caswell County, I am at the Prospect Hill Community Health Center. We do have 3 other locations, so if anyone has questions about those, I can provide information for those sites that have MNT as well. But here's just kind of our address and the clinic phone number. If anyone has questions more specific to MNT in general, though, it probably would be easier just to contact me on my home office number. But if someone's wanting to become a patient or any of the other services that PHS provides, certainly they can contact the clinic. With that, pretty much any insurance type can be accepted here, Medicare, Medicaid, private. And if someone is either uninsured or underinsured, we do have some self-pay options. It's sliding fee based on income. And then there's kind of also more information online, or I'm always available by email. So that's everything I had. I don't know if anyone has any certain questions.
Kaitlin, this is Laura. I just have one question. So I guess, is there any type of age like limit or requirement that you have to be 18 or something to receive these services, or is it open to all ages?
No, it's open to all ages. So I've seen from 6 months up until I think like 92 has been the oldest patient that I've seen. And they don't have to have a specific diagnosis. Well, to an extent, I guess something technically that would qualify them for MNT in general. But I mean, whether they're pre-diabetic, diabetic, and like I said, even if they're just overweight, working on high blood pressure, I mean, there's things outside of diabetes where they can meet with me as well.
Okay, great. Any other questions for Kaitlin? Okay, well, if there's no other questions, of course, you can contact everyone that's been speaking today, either, by email or phone. And if you need help getting connected, then just let me know. But we do appreciate everyone's participation today, and hope that you've learned something new, maybe a new solution that could help someone that you work with to have better health outcomes as it relates to diabetes. So as I said, this meeting has been recorded, so I will share it out. So if you know anyone else that could benefit from learning more on this topic, then we welcome you to share it. But if not, then that's all that I have today, and I do appreciate everyone's attention. Hope everyone has a great rest of the day.